Welcome to Victoria Rumble Room, a show that endeavors to bring you the important issues from Greater Victoria, Vancouver Island, British Columbia, Canada, the wide world. I'm Robin Adair, and as always, we really appreciate you checking in on this program, and we hope we can convince you to come and join us every week. With me, my co-host with the most, John Jurisic, the Croatian sensation. And John, big news, we have a new milestone for the big show.
You know, Robin, when we started this almost exactly a year ago, I thought maybe 10 people would watch us. We'd have a lot of fun, mucking around. 400,000 cumulative views across all of our platforms since we began the Victoria Rumble Room. That was a surprise. Clearly, people enjoy what we're doing. But more than that, we enjoy and appreciate the people that are watching and listening and commenting. So thank you very much to all of you. And thank you very much for sharing. Increasingly more people are sharing our clips. Means a lot to all of us, right?
Absolutely, John. We're moving now into our second year. This is the beginning now of our second year of the Rumble Room, and we're evolving all the time. And we now, of course, have this group site that we'd like to draw your attention to again, Victoria Rumble Room News and Views. And, there's no big requirement, nothing special. You can sign up. You just have to agree to some simple rules like no swearing, don't do anything crude. We don't want bigotry, but you can express yourself. You can say what you think. You can even post materials that you think support issues that are important to you. And we want to encourage you to really have your say.
So let me just emphasize the difference, because some people are going to go, you got a Rumble Room Facebook? Why are you setting up this News and Views? Because on News and Views, you can post your content. If you have something to say, if you have a story, if you have an event, you can join this group and you can post that. And we will only be filtering out clearly bad content that is, like you said, rude and offensive and potentially all those other bad things that go on the internet. The address is facebook.com/groups/VRR News and Views. And join us and many thousands of others in getting involved in the Rumble Room communication dissemination.
Absolutely, John. And we don't discourage the use of other groups. We use ourselves, other groups, to get our messages across, and excellent groups that we belong to, actually, and participate in, like Vancouver Island Breaking News and many others. So it's not a competition with other groups. It's just that people who enjoy the Rumble Room and would like to participate directly with what we're doing, we want to make that available. So that's the end of that pitch. Let's move on to our first big issue, which is, and has been for quite some time, this terrible doctor shortage that we're facing. And it seems to go on without end. The Victoria branch of Island Health has recently staged a forum. It was on Facebook. It was public. And they talked about a number of things over the hour. They talked about COVID-19. They talked about long waiting lists at emergency. And I really wish they'd talk more about the doctor shortage. It seems to me that's the big issue. 850,000 British Columbians do not have a family doctor. On the South Island, out of 400,000 people, 100,000, that's 1 in 4, do not have a family physician. It's terrible. This is a crisis. And Camille Currie from BC Healthcare Matters speaks on this very issue in just a moment. But first, let's hear how the folks at Island Health address our number one health issue.
Our first live question is for Dr. McDonald, and it's from Camille, who's with the group BC Healthcare Matters. And Camille's question is, do you consider UPCs a solution to the family doctor shortage when many aren't able to attach patients to a doctor?
Thanks, Camille, for the question. And I think, yes, they are part of the solution. They're certainly not the only solution. They are making a difference. We're proud of the fact that since the 5 have come online over the last 3.5 years, they've seen over 200 1,000 patient visits. So they are making a difference, and we are trying to increase capacity for attachment. We've had some of those new physician and nurse practitioner positions that I talked about recently being added to the UPCCs. They are people that are going to start taking on panels. We will see that attachment grow over time, and as the UPCCs come up to their full complement, we will see much more of that. But again, remembering that the UPCCs are one part of the larger primary care strategy, and investments are also being made in existing family practice offices and the other types of clinics we talked about, CHCs and nurse practitioner clinics as well. So it's all part of a larger system.
And of course, the doctor shortage is top of mind here. You wanted answers about the doctor shortage. You asked if Island Health's strategy of bringing 5 urgent primary care centers to the South Island was going to ensure attachment for people who need a doctor. Did you get the answer you were looking for?
Yeah, no, we really didn't, honestly. The one thing that kind of jumped out at me with the response that was given actually is, the health authority keeps mentioning the 1 million visits that they've accomplished since the UPCs were started. And, kind of came to my mind thinking, well, if the health authority is tracking those numbers of visits, why don't they start also tracking the number of people that they're turning away every day and ever since the creation? I feel like that would give us a much better picture of the effectiveness of these UPCCs instead of just a one-sided number.
It's so great that you're pushing and advocating this issue forward, really, on behalf of all of us, Camille, on behalf of all of us. The public forum on Facebook didn't leave a lot of room for questions on the doctor shortage, but the panelists acknowledged the problem. And the president of Island Health, Kathy McNeil, even mentioned she didn't have a family doctor herself. It seems that Island Health is making the best of the situation. It seems that way. But it's government policy and funding where the big changes need to be made, right?
It's so true. I really appreciate that these people are coming forward to try to hold these forums and do this. I mean, it shows that there's effort being put into it, but we were honestly really quite disappointed with the way that the responses were really scripted and prepared, and they felt like the same answers we've been getting over and over, and we just feel we deserve more than that.
Do you have the feeling that government thought they could manage to convince people that this could all be staffed by nurse practitioners and some doctors, but that hasn't really worked out because there aren't enough nurse practitioners, and doctors who've gone to work in these centers don't stay because they for whatever reason, they're not happy, and a lot simply don't want to go in. So we're not winning on either side. We are building these centers, and they are ill-staffed.
Absolutely. And I feel like that is still coming through in all the answers that they provide to us. And so it's really concerning that they're not addressing our question of how will you staff these facilities and what measures are you taking to draw in more nurse practitioners and more doctors to our province? Stop telling us about, infrastructure and ways that you're moving around resources. We want to know about new blood coming in.
Camille, your BC Healthcare Matters campaign and website is really gaining traction. Congratulations. You appeared on our local TV station, Check TV. You were introduced at the legislature. Your petition is growing. How soon do you think you're going to deliver your petition after seeing the legislature in action? ? Do you think it can still make a difference?
I absolutely think it can still make a difference. I am so grateful that our petition was able to be mentioned in the question period. I think it was a great opportunity for our voices to be heard and for the government to hear how many of us are behind this petition, behind this campaign that I'm pushing forward. I hope that we can have this petition tabled in the legislature sooner rather than later. And I really do think that it is something that can help bring about the results that we need to see. The other part to our campaign is our lawn signs, and they're taking off like mad. And I'm so thrilled to see all the people that are encouraged, that want to, send us a message asking for a lawn sign. People want to represent. They want to show their discontent with the way the system is right now, and that we all need more, and we want transparency, and we want answers.
I think over the last 3 years, there's been 635 new doctors come to the province to set up practice. But what he doesn't say is, well, how many doctors at the same time have retired? And of those doctors that have come in, how many are still practicing? And who's left? And who's gone to the States? And who's moved into other things or gone into specialties? We don't really have a clear picture of what the terrain really looks like, do we?
We really don't, and I know that some members in my group have even made some freedom of information requests so that we can see some of the facts, break down these numbers for us. I'm a little tired of hearing just the digit. I want to know what that digit means. So I want to know how many of those doctors go into being hospitalists instead, or how many of them go to work in urgent primary care centers, which isn't currently addressing the primary care need. So I'm on the same page as you. I'm getting frustrated. I'm getting frustrated by the same numbers coming back, and I want more clarification about them. I think that would help us all get on the same page to work on the solutions.
And just part two to that, a lot of the doctors that are apparently coming in, and the forum last night mentioned this, the new doctors are saying they don't want the traditional style of practice. They welcome working in a different way and maybe even getting paid in a different way, but they don't seem to be moving towards the urgent primary care centers. Do we know why?
Yeah, it's a really interesting question. And I think I'm honestly just scraping the surface of it right now and talking with some doctors that have had experience, perhaps dabbling into the UPCs and then made the choice to not pursue that, or others that have simply made the choice not to go into that environment. And it does seem like it's a lot of how the facilities are run, how the supports are set up, how the team aspect works. And that's a really big one that I'm hearing, that, we're talking about the government insisting we need team-based care, and we are not denying that. There is a lot of validity to team-based care, but it doesn't seem like the UPCCs are functioning in a team. So why would a doctor want to go there if they don't feel like they're part of the team and they don't feel supported?
Hey, Camille, you mentioned that that you've had some liaison with the BC Liberals. You've met with local NDP MLAs like Murray Rankin, but are you any closer to a sit down with the big kahuna, Health Minister Adrian Dix, right? You saw him scrounged recently. If you could ask him a question on the record right now, okay, what would it be?
I would want to ask him, how long is it going to take before you provide us with specific solutions for the 1 million citizens currently struggling in this healthcare system without a family doctor?
And do you expect to get the answer?
I'm really not sure on that one. I got to tell you, Robin, so far the answers we've been getting from government do not leave me with that much hope that I will get the true specific answer on that. But that feeling, I can't let that deter me. So no matter what, I'm going to keep pursuing and pushing to get to that answer, because somebody has it and somebody is going to help us get that answer. And I'm just waiting to see who comes forward to assist us with that.
Camille Currie, wow. I'm blown away by how impressive and articulate and how well-spoken this person is. I think if she decided to get involved in politics, I think she'd be very popular and have a very bright future, right? But her priority right now is to see changes in our healthcare system. I wish that was shared, Robin, by others, other politicians. It's a tall order to have a doctor for every British Columbian. But she's a very determined person. Oh man, I would not want to get in her way or anything. And again, if you want to sign up, I encourage you to sign up to the BC Healthcare Matter petition. Go to their Facebook site, go to their website, make your feelings felt and support Camille in her efforts.
And we'll keep watching this story closely, John, because we're very supportive of this notion that people and individuals can take steps in society and really make big changes. Camille's really committed to that, and we're committed to seeing this work. We want to all see more doctors. This is a way to do that, and we'll push on that.
Yeah.
But let's move on now to another topic, which is Well, it's actually been a topic for the last 2 years. It's just taken on another evil form.
Yes.
COVID-19, and in this case, COVID-19 and cruise ships.
Oh, man.
And the first cruise ship to dock in a Canadian port in 2 years was supposed to arrive on the 6th of April. And this didn't happen. The reason Royal Caribbean is giving for this cancellation is the ship needs to have dry dock work in Oregon. But the real reason is that there was COVID-19 on the ship, on this Royal Caribbean ship, as it was sailing from Florida around through the Panama Canal. It's repositioning for the run on the Alaska summer schedule, and lots of COVID broke out on the ship. And now all the passengers on board have been flown home. All these passengers have been vaccinated. And all of the onboard staff reportedly also vaccinated. So this was supposed to be a safe trip, but COVID, John, has again reared its ugly head.
Robin, it never went away. And a lot of folks might have overseen that fact. We are in a far better place than we were 2 years ago, obviously, but it is still here. Our next scheduled cruise ship arrival is on Saturday when the Holland America arrives. The local tourism industry is definitely ready, and we're all nervously watching to make sure this new cruise ship season is safe. Try to say that 5 times in a row. Let's hope so. Certainly the tourism industry is perking up in a big way and cannot wait for this influx to our local economy to start coming back regular.
That's right, Johnny. The hotel numbers are way up from last year. Here's the graph from Destination Greater Victoria. We're approaching the same booking numbers that we had back in 2019. That's before the pandemic hit. And I know Paul Nursey, the CEO of Destination Victoria, that's Destination Greater Victoria, is optimistic, and he's here to talk about the coming tourism season. Let's zoom him in.
Paul, so great to see you. Okay, the region is so lucky to have a CEO of your expertise and experience. Very lucky. We're going to chain you to your desk. Okay, you can't leave us now. Great news about these hotel bookings. Great news. Tell us about some of the peripheral stuff, that being attractions, restaurants, businesses that cater to tourists. Are they back to regular staff members and regular hours? I'm quite sure, as we've seen, it's been tough for many of them to keep their doors open over these past 2 years.
Yeah, so that's the part that's going to lag a little bit, and I'm so proud of them because they're the ones that have really been taking it on the chin, as have hotels, have everyone related to the meetings and conventions business or the live festivals and events business or the concert business or the cruise ship industry. But ultimately, it's one holistic experience for the guest, right? You don't just come to stay in a hotel room, even though we've got beautiful inns and boutique hotels and bed and breakfasts. But hotel bookings are the lead indicator. And then, once people settle in their hotels and they spread out and do things. And I'm just going to put on the record now, our guests don't give anything at all about municipal boundaries. They'll go to Butchart Gardens in Central Saanich, or they'll go to the West Shore to experience golf at Bear Mountain, things like that. And these experiences providers are the secret sauce of the experience and the destination. And regrettably, their revenue is going to trail a little bit because we need to get them into the experience first, and then have them experience things. So that's our next big challenge. We're ramping back up our visitor services operations. We're ramping back up our digital and all of our blogging experience. And of course, so much is happening in the private sector. Many of them are challenged with staffing issues, but that's starting to come back as well. But they've done a great job. And I think, as we get into the summer, they're going to start to see the benefit. But the reality is also it's an uneven recovery. Some of our important overseas source markets are going to come a little bit later, but they are coming. So, for example, anyone in the European Union who had a trip booked, their consumer protection laws are such that has to be honored. So even though it's been 2 years, people are coming from Germany and Great Britain, and Great Britain's out of the EU, but they have similar laws, France. They're going to come. That's not a huge number here, but they're coming, and we're seeing that pick up again. Conferences are coming again. They're booking. We're starting to see them materialize. Our first big one was about 10 days ago with Fountain Tires. So this stuff is all starting to happen again. And again, revenue And predictable revenue will allow these businesses such as attractions, restaurants, the confidence to invest in people, invest in long-term planning, because it's been so week to week and month to month. I know this is a very long-winded answer to your question, John, but most have made it through, and it's our job to show them as a tourism board that pathway back. And so the hotel bookings are that lead indicator, and then this is the next wave, right? So, and that's why we need multiple different source markets firing all at once, and not just Canadians driving in their cars, right?
And speaking of that, April 6th, we have our first cruise ship in 2 years arriving in Victoria. I realize the cruise ship industry doesn't really benefit, at least directly, the hotels, because people don't stay. But it must make a huge difference overall to the hospitality and service industry on the South Island.
Yeah, so the cruise ship industry is really important for a couple of reasons. First and foremost, it pays for the assets operated by the Greater Victoria Harbour Authority, right? So they're, what would happen to Fisherman's Wharf, or what would happen with the Lower Causeway, and what would happen with, the walkway at Ogden Point, that residents and locals happen if it wasn't for that cruise ship revenue. The second reason it's so important is that it, really drives revenue. Well, some of our hotels, their outlets benefit, their spas, their restaurants, high tea, that benefits directly. Attractions benefit. Craigdarroch Castle does extremely well. Chinatown does extremely well. All those important merchants in Chinatown, and of course, Butchart Gardens and others do well. But it also introduces visitors for the first time into the region, right? And a certain percentage will come back later. So, cruise ship industry is not the whole industry. It's a segment of the industry. But, we're not in a position to be negative towards any segment. We're grateful for it all. And so, just like every professional portfolio manager needs a well-diversified portfolio for their clients, we need a well-diversified portfolio, including sports tourism, meeting tourism, individual leisure travel, group leisure travel, and cruise. We need it all. And so we're really grateful that and the Harbour Authority has done a fantastic job getting ready for this.
So, Paul, let me talk about one of the elephants in the room. I think there's many, but one of them being the American tourist.
Yeah.
And our sense is that they're starting to come back in big numbers from the ferries and the coho. Certainly over the last 2 years, I suspect Canadian tourists carried a lot of the ball for tourism locally. But American and foreign tourists must make a huge difference to the bottom line. How is that coming along?
Yeah, that's exactly right, John. So an American traveler, and I'm going to just preface it by saying a fully vaccinated American traveler, because no unvaccinated travelers will be allowed in, which is
right on.
A Canadian traveler, because we still have 6 or 8% of unvaccinated Canadian travelers, which could be right next to you in a theater, and you would never know it, right? Well, I guess they have the vaccine passport for now. So right. I think, everyone should rest assured that only fully vaccinated American travelers are coming. And they do contribute on average about 70% more per day in terms of investment, in terms of return on investment. They're free spenders. They have a currency advantage, and they come from very wealthy source markets. Our big marketing campaign is pushing into the United States April 1st. And that's just when rapid antigen testing is dropping. We've gone ahead with some earned media, all that behind the scenes stuff like Google paid search and stuff like that. That's been wrapping up for a couple months now. And, Clippers are a vital connection, and that will start service again April 15th with 1 sailing a day. Coho has been operated, on a reduced schedule. We're working on some airline connections, which will probably take several months and maybe into next year. But we have to get that U.S. connection back. A lot of our visitors do come up through Vancouver from the United States, and that's okay. But it's coming along. And that's so important for the mix. Because as you said, John, the Canadian traveler has been the base, but the profitability comes from the U.S. and the international, and more importantly, the conference visitor. It's one thing to keep the lights on. It's another thing to actually start erasing the red ink that's on the balance sheets of all these small businesses across town.
I know that everyone wants tourism to succeed this year on the island. I mean, it's our main industry. Sorry, technology, but I consider it the heartbeat of Lower Vancouver Island. We need it to come back. We're keeping our eye on it. We're keeping our eyes on it, okay? We all want to travel right now. Man, I'd love to. And it seems like, at least from the Facebook posts that I see and people that I talk to, half of Victoria is traveling. They've been off to Hawaii, California, Mexico. over the last 2 months as health regulations have relaxed. So you know, things are picking up. We want the new normal, and you're right that it is a new normal, to include travel. That includes travels coming here, not just going away.
Absolutely, John. And let's hope for a prosperous summer for all of us. And we now are getting close to the end of the program, but I'd like to touch on a couple of other issues before we say goodbye. For example, I see the provincial government is making more noises about a moratorium on old growth logging. So what does the future hold for First Nations who actually operate sawmills? Like some answers. What about our forest industry? We'd all like to see preservation, but we also would like to see some of these high-paying jobs maintained that support families across the province. So what are the answers there? What are the solutions there? Lots of questions. And we'd sure like to have some answers.
Absolutely. And, Robin, there's also been a trickle of refugees arriving from Ukraine as that bloody, ugly, murderous war continues. My question is, will we be ready when that trickle starts to become a flood? Oh, man, the social issues facing our society, they're overwhelming, because certainly a lot more refugees are coming, Robin. We'll try to get answers for you next week. Come and listen to us.
Absolutely, John. That's going to be really fascinating to find out more about the Ukrainian situation, the perspective of people coming here because they need a safe place, a safe haven. And who knows, some of them may stay permanently, which is good for Canada. But I think in the short term, it's very hard for these folks. But now we are indeed, John, reaching the end of this program. And we again want to thank all of our viewers for tuning in and sharing with us all this information, this great insight that we have that we're able to partake of every week and share with you. And there are a number of different ways that we can share this. Could you again go through our various sites on how people can like the show, follow the show, including our new News and Views group site?
We can't say enough, after 1 year of doing this and having a ton of fun, how much we appreciate everyone watching us on the various platforms in which we distribute this content. Our core content is through Facebook. We have a Facebook Rumble Room site. We have a Twitter site that's increasingly getting more popular and being responded to and being retweeted. We have a YouTube site which houses all of our stuff. And of course, now we have a new Facebook group in which you and you and you can all participate. And that being, as you've stated multiple times, the Victoria Rumble Room News and Views Facebook group. We also have an Instagram site and a TikTok site. So there's no way that you can't participate in what we think is a pretty fun and informative time. So, as stated, we are now ending the show. I continue to remain, after 1 year, the Croatian sensation to the nation, Johnny Jurisic.
And John, you know, ever since I was a young boy and the Beatles arrived, I always said I'd like to be in a group. So I think about that with the new group site. I'm Rockin' Robin Adair, and rumble on.